To give you an idea, about a third of the cases we see as a neurology service in the veterinary hospital are cases with some sort of spinal cord injury. So it is very common. It's about probably 500 dogs a year here in Bristol. Treating spinal injury has these two major steps. One is to treat the acute phase, so when the dog becomes paralyzed. So it could be surgery for realigning the spine, it could be surgery to remove compression on the nerves. So that's one set of treatment. And the second set of treatment would be in the chronic phase for those animals who have not recovered. So they had a bad injury, remain paralyzed. One of the treatment that has become potentially very useful is to use cells from the nasal cavity, from the nose, and harvest them from the nose and transplant them in the spinal cord to help the cord to regenerate. The start of the process will be having a small biopsy from the nose, which is probably a very small fragment of tissue that we then process and put in a dish, and the cells will start to expand. So there is a process of multiplication where the cells grow to reach the number we wish for transplantation. Our olfactory system or smell system lose its neurons all the time because they're exposed to air, dust, smoke, and so on. So we lose neurons in the nose all the time, but they do regenerate, and we do keep our sense of smell all the time. That doesn't disappear. And the reason for that is because new neurons forms in the nose naturally, and they link with the brain all the time. And to do this link, they need supporting cells. Olfactory cells are supporting cells, helping nerves to grow and make connection with the brain. So that's the natural history of what's happening in the smell system. But if you do take these cells out of their natural environment, put them in a damaged region of the brain or spinal cord, then they do carry on having this function of supporting nerve to regrow. And what we're trying to do with the spinal cord is really bridging the gap, the lesion gap that's been caused by the trauma. So we put the cells into the lesion, and hopefully they will help the nerves to regenerate. You can see or you can detect an effect of the cells in the sense that you see a change in locomotion. So these dogs can walk better with the cells and regain some controlled movement of their legs. Now, it's not a magic treatment, and obviously not 100% of the dogs who would get the cells get an improvement, but we had enough success to show scientifically that this was valid, and about 25% of the cases we transplanted in that way had some visible changes with the naked eye on their gait and legs movements. Using these cells, I should say, has been done in humans as well, but as safety trials. So it's only a very limited number of people or patients. The way forward would be to try and improve how we deliver the cells into the spinal cord, because it's one thing to inject them and show there's an effect. It's another thing to then go into a person and how do you actually deliver the cells so they survive and are numerous in the lesion. So there's a problem with how do we deliver them. So of course, when dogs get paralyzed, they also lose control of their bladders, and so they become incontinent, which is a big problem. And one of the methods we've been testing in dogs to solve this problem is to use what we call neuroprosthesis. They are small silicone implants we can place on the nerves below the lesions. If the lesion is in the middle of the back of the dog, you can still exploit the spinal cord below the lesion that's there, and it's usually fine and has survived. It's a technique that's used in humans, been used for 30 years in humans, so it's not new, but it's one of the examples where something that is working in humans we've taken it from humans and then implemented it in dogs. So it's actually the other way, it's a reverse translation, isn't it? So by putting neuroprosthesis, small implants on the nerves, you can so you do a surgery for that. You can take control of the nerves that are remaining and that are going to the bladder. And it is very effective, and you can then, with a remote, control these nerves in different ways. So you can empty the bladder regularly, which obviously prevents from having to do it manually, pressing on the tummy of the dog, which is a bit distressing for the owner, or putting catheter into the bladder, which creates infections a lot of the time. So neuroprosthesis is a good way of exploiting the preserved part of the spinal cord.